Nicole and I met 7 years ago.
About 5 years ago, we started trying to have a baby.
I have been dreaming of a family since I was a child.
A couple years into it, Cody went to have a semen analysis to find out if there was an issue causing us not to get pregnant, and he was told that everything looked normal.
Nicole and I both assumed that there was something wrong with her reproductive parts. I could see Nicole's hurt starting to become almost an underlying anger. She would make the comment that, "I can't have children, you should have picked a different wife. I'm not good enough." When Nicole had tests done a year ago, it was discovered that she was completely fertile. Our doctor ordered additional tests to be done on my semen. It showed that I was unable to conceive children naturally. And that this was from the blunt force trauma I had suffered in a fall 6 years prior. In a moment, the tables turned, and now I'm the one to blame. I'm the one that's broken.
He would tell me all the time that I picked the wrong husband, that he wasn't worthy, that he didn't deserve to be with me, that I should find another husband because he wasn't able to give me the child that I so desperately wanted. And I felt terrible because I felt that way for years, thinking that it was me.
I told Nicole that I was very open to the option of adoption and foster parenting.
I just didn't feel like adopting was the right choice for me.
Nicole said she wanted her own children.
When I brought up using a donor sperm to father a child for us.
Sperm donor. I thought, well, why would I want a child with you that wasn't my own?
Cody has been completely against it. This journey of infertility has been difficult. We don't talk about it. We just avoid the topic completely in order to avoid heartache and pain and arguments.
Nicole and Cody join us, and watching that tape piece, I can see the struggle and the challenge that the two of you are having coming to some type of resolution here. There's a true conflict. You know, what advice can you give couples who clearly are having trouble meeting in the middle?
First of all, let me just say, which I'm sure you guys know because you live it every day, you can just tell by that tape that you guys are just crazy in love. So that, I mean, that is a wonderful thing. And the advice that I would give you is put yourself in each other's shoes. Because remember, I think we thought that it was first you that had problems conceiving, and then it was you. So I think if you just switch and go into each other's shoes and figure that out, that would be helpful. The other thing is keep it open in terms of options. And I guess the last thing I would say, that just think about this when I say this, is that being a mother and a great, amazing dad has nothing to do with DNA. It has nothing to do with DNA. It doesn't. It doesn't.
That's right. And I see that all the time, and I say that all the time to my patients, to women, that the least of which that makes us parents is our biology. But I deal with infertility issues every single day as an OBGYN, and most people don't realize that 30% of infertility cases are due to what's called male factor. And just like if a woman has problems conceiving naturally, it doesn't make her any less of a woman. Yep. This does not make you any less of a man. Yeah. And that is very important to remember just going forward.
So now you're in this situation where you're trying to figure out what to do, right?
Yep. Yeah. We've had some testing done more recently. And now that we have an answer to what the problem is, we're going forward from here.
And Cody's mentioning something, because to be sure that Cody and Nicole were getting the best information, we did send Cody to board-certified urologist Dr. Spitz to get a second opinion.
Have there been any pregnancies that miscarried?
There haven't been.
Okay. I understand from your history that you were involved in a traumatic fall while at work several years ago. Can you tell me a little bit about that?
I fell about 18 feet off of scaffolding. I landed on my rear end. It caused a pelvic floor injury, which in turn led to a vascular occlusion.
Well, what I'd like to do is examine you, all right? And what I'll do is I'm going to examine your genitals and your prostate because that's all important in the production of the semen. Now, aside from that fall, have you had any other injuries or any other surgeries?
Yes, in 1984 I had a right inguinal hernia repaired, and then again in 2000 I had the left hernia repaired.
This is the smoking gun as to why a pregnancy has not occurred yet. Why is this happening to you? Well, there's a couple of possibilities. We could look back to that accident when you had the trauma. Clearly there was trauma to your genitals, but also you had previous hernia surgeries. And in some cases, the hernia operation can injure the vas deferens, the tube that carries sperm,
Yes, sir.
even just a little bit, but enough for the immune system to see the sperm and set up an antibody reaction.
And after looking over Cody's test results, this is what Dr. Spitz wanted you to know. Let's check it out.
The antibody production will be ongoing and chronic, so we have to work around it. And there are basically two options that you can look at. The most successful option is in vitro fertility with intracytoplasmic sperm injection. And what that means is that eggs are taken from Nicole, and then the sperm from you, Cody, is directly injected into the egg, 1 sperm per egg. The other option is intrauterine insemination with a special treatment of the sperm with an agent called chymotrypsin. It is not nearly as successful as the in vitro fertility approach, but I'm quite confident that you will be able to have a child.
Well, certainly a big thank you to Dr. Spitz.
You know, you guys look so you can see the relief already just watching that, and I know it's such an important moment when you get good news like that. So you have a lot of options, but if you decide to go down the IVF pathway, we wanted to give you guys a good shot, and so we did reach out to Dr. William Schoolcraft at the Colorado Center for Reproductive Medicine, and he has offered to do 1 round of IVF for you if that's the decision you make.
Before we go, what are you feeling right now?
So thankful and grateful. This is truly a miracle for us.